Hi, I'm Dr. Andrew Shanahan, and I am the Medical Director of the Cardiac Catheterization Laboratory at Princeton Medical Center. Today, I'm going to talk to you about cardiovascular disease, heart attack treatment, and the radial artery catheterization program offered in our cath lab. If your physician has referred you or a loved one for cardiac catheterization, you might be wondering what to expect during the procedure and how physicians will use the information learned through the test to care for you. Cardiac catheterization, or cardiac cath, is a relatively common procedure that physicians typically order as part of a battery of tests to determine the health of your heart. During a cardiac cath procedure, a long flexible tube is gently guided through your blood vessels towards your heart. Pressure measurements are made, and contrast dye is used to make x-rays to identify arteries and potential blockages. The Cardiac Cath Lab at Princeton Medical Center offers diagnostic cardiac cath with both the traditional femoral approach in the groin and now radial artery catheterization, where the artery is entered at the wrist with a slender catheter. A quick test of the pulse in the wrist can ensure you are a candidate. Most patients are candidates, including those who are taking blood thinners or who are at high risk for bleeding. The radial artery approach increases comfort and decreases recovery time post-procedure. It can also shorten the time to discharge. Most patients sit up immediately after radial cath, instead of long periods of bed rest with the traditional approach. After the procedure, we use a pressure band on the wrist to improve mobility and comfort. The procedure has been shown to reduce complications in a large spectrum of high-risk patients, including women, obese patients, older patients, and those who have had a heart attack. For people who don't want or can't have a cardiac cath, we offer CT coronary angiography. In this non-invasive test, a CAT scan image looks at the arteries that supply blood flow to the heart. The test can be used to diagnose the cause of chest pain or shortness of breath. When compared to current traditional therapies, CT coronary angiography has been shown to reduce a patient's length of stay in the hospital and improve the time to discharge in low-risk emergency patients with chest pain. At Princeton Medical Center, we have a fully digital cardiac catheterization laboratory. The lab is dedicated to providing prompt and accurate diagnosis of heart problems such as heart attack, coronary artery disease, valve disease, and muscle disease. The use of digital imaging in our state-of-the-art laboratory ensures the capture of high-quality images while dramatically reducing the amount of radiation exposure.